Hello, my name is Brian Hoffman. I'm a student physical therapist assistant at South University, and today I'm going to talk about thoracic outlet syndrome and how physical therapy can help. We'll be seeing a patient with physical therapy later. So what is thoracic outlet syndrome, commonly called TOS? It is a broad term to describe compression of the brachial plexus. The brachial plexus is behind the collarbone and below the first rib on either side, on the left side or right side. And when this area is compressed, people can experience symptoms such as tingling or pain. And without proper treatment, this tingling and pain can turn into paralysis and increase the pain. And when the pain increases, people don't want to use it, so it can also cause atrophy or weakness of that extremity. So what can cause TOS is really anything that causes that compression. So traumatic injuries from sports like football or from car crashes, anything that causes that compression could cause TOS. It could also be caused by abnormality in that brachial plexus region, an abnormal rib or anything like that. It can be treated with surgery and with medications, but the most common way to treat it is with physical therapy and specific stretches. What can cause thoracic outlet syndrome is anything that causes that compression. So sports injury from football or a car crash, anything that causes compression or anything that causes that compression will compromise it, and you will experience those pains and cause TOS. The good news and bad news about thoracic outlet syndrome is that you can cause it yourself with poor habits, but you can fix it by fixing those habits and with physical therapy. So the patient we'll be looking at today is one of those patients who she has some pretty bad habits that caused her thoracic outlet syndrome. She's at a pain of 7 out of 10, just normally, and she can't rotate to the right through her bad habits. Like she can't rotate to the right fully. She experiences pain, paresthesia of the arm, of her left arm. She's a telemarketer who holds a phone like this. She's got a baby that's always like this. So the muscles in that specific area on her left have increased and gone so tight that it's causing her symptoms of paralysis, of pain. Our goal for physical therapy is to stretch those tight muscles, improve her posture, educate her on how to better her lifestyle to decrease her pain, because the good news is it is completely curable. So we're hoping in the next 2 weeks to get her from the max phase she's in now to the mod phase, where her pain is not a 7 out of 10, but a 3 out of 10, and where she can actually rotate her head to the right a little bit more. Right now, she's at 20 degrees. We want to get her to about 40 degrees in the next 2 weeks. And then from there, we can increase the exercises. But why don't we meet the patient? Hello. This is that patient I was talking about who has TOS. What's your name?
Priscilla.
Priscilla. All right. Is it all right if I call you Priscilla? Okay. My name is Brian. I'm a student physical therapist assistant. And today we're going to help some of your problems you've been having, or TOS. So at some point, some of these exercises, I'm going to have to put my hands on you. Is that okay? All right. So if you feel any pain or discomfort during any of that, let me know, and we'll adjust accordingly. Okay. So it says here your doctor prescribed you with TOS, that you can't turn to the right. That you can't. Yeah. Understandable. And that you're at your worst, your pain is at rest is a 7 out of 10. Is that
yes.
Right? Okay. So what we're going to do, we're going to work on some exercises to help you with your rotation and with that pain, and hopefully in a couple weeks it will help, and then we can increase the exercises.
Okay.
So right now we're going to do a couple of tests to assess just how far along it is. So first I'm going to do something called a manual muscle test of your upper traps. So what I want you to do, come on, face me. I want you to shrug your shoulders to your ears. Okay, relax. All right. What I'm going to do is I'm going to do that same motion, and I'm going to resist you. All right. resist my resistance. Okay. 1, 2, 3. Okay, relax. All right. I do feel a bit more tension on your left side. I noticeably see a lot more tone and hypertrophy, and that extra muscle is putting more compression on those nerves and blood vessels. And we can help stretch those out. What we're going to do next is we're going to assess your cervical rotations. So if you can go ahead and lay down with your head on here, please. Don't worry, patient, I've washed my hand. So what I want you to do is I want you to turn your head, just turn your head to the left all the way that you can. Good. Go ahead and turn your head to the right as far as you can. Okay. Is that as far?
Mm-hmm.
Okay. That's where you start hurting?
Yes.
Okay. We'll do it for you. Okay. Okay. I'm going to do it to the tight side. Let me know when you feel pain.
Ow.
Right there? Okay. So active range of motion and passive range of motion is compromised. So what I want you to do is I want you to turn your head to the left. All right. So that's 90 degrees. All right, go ahead and put your head back up or back to neutral or nose to the ceiling. What I want you to do is I want you to go to your right side and just hold it as long as you can. And yep, just as I suspect, it's about 20 degrees. Go ahead and relax. All right, thank you. So yeah, there's a noticeable difference between your left and right side. So what we're going to do, we're going to work on stretching that out and helping out with that. So the next one we're going to do is something called the Halstead test, and this is going to assess just how impacted that area is. So we're going to simultaneously stretch your arm back and take your pulse, and I'm going to want you to turn to the right and look up as I do it. Okay? Left arm. You don't feel any pain right now, right?
No.
Okay. So, all right. Get the pulse. Looking up. Okay. Let me know when you feel pain. Right here.
Mm-hmm.
Okay. And does this relieve it?
Yes.
Okay. And your pulse noticeably dropped. So that is an objective test to test whether you have TOS, which you do. So right now we're going to work on some exercises that will help you get through that or help relieve that pain. So the first test we're going to do is called the scalene stretch test. And what I want you to do is I want you to sit up straight just like you're doing. I want you to stabilize your hand and hold on here, and I want you to bring your right ear to your right shoulder as much as you can, and then try to bring your chin up to the ceiling. Okay. You don't have to do it on both sides. Remember to breathe. You feel any pain? And I want you to hold there for 30 seconds. And relax. And I would have this patient do it 3 sets for 30 seconds. And what that exercise is doing, it's stretching those tight muscles out there, and it's stretching it and relieving that pressure, and it will help her limitation of turning to the right. So the next exercise we're going to do is called the dorsal pectoral stretch. So what this is going to do, it's going to stretch another muscle, but it's going to be her pectorals. So what we're going to do, we're going to head to a doorway. And what I want you to do is I want you to put your arms like this, feet together, and then just keeping your arms at 90, elbows at a 90 degrees angle as much as you can. And just slowly move forward, keeping your head up, and good posture. All right, go ahead and do that. All right, that's good. You feel that stretch? You're going to hold it for 30 seconds. Is that too easy, or?
It's easy.
It's Easy? Okay. And if you wanted to increase the difficulty of this, I would have her move her arms up, and that would increase the stretch of that tissue, and that will help relieve that pressure on that tight area and relieve the pain. All right, 30 seconds. Okay, so she would do that. We would have 3 sets of 30 seconds each, and again, it will release that pressure. So the next exercise is purely a postural exercise that will help increase your posture. We're kind of limited on wall space here. So Priscilla, what I want you to do is I want you to keep your heels at the back, keep everything at the back, and keep your head just like this, shoulders back to the wall. And I want you to hold it like this, keep your chin tipped up, and I want you to imagine holding a glass of water in between your clavicles. I don't want you to go like this because that's going to spill the water. I want you to stay just like this, and you're going to hold for 30 seconds, okay? Nope, I want you to put your heels up against that. All right. That's good. Checked in. That glass of water is staying there. All right. And if that gets a little too easy, what she can do is you can put the back of your hands to your wall like that. All right. And she could go up and down, but is too much. Okay, you can just hold like that for 30 seconds. Okay, 30 seconds. You do 3 sets of that. And that was the functional test. What we're going to do now is exercise that will help improve our posture and increase those rhomboid exercises. And this is called the bent row test, or bent row exercise. So, Priscilla, what I want you to do is I want you to keep your arms like this and hold TheraBand. And I want you to bend in and squeeze, just like that. And I want you to pretend that you're squeezing a tennis ball right in between your scaps. I don't want you to raise up your shoulders. I just want you to focus on this, okay? All right, do that. And no, raising your shoulders. All right, go ahead and back, squeeze, good. And I want you to squeeze for 2 Mississippi. 1, 2 Mississippi, 2 Mississippi, okay, back. Again, 1 Mississippi, 2 Mississippi. Again, 1 Mississippi, 2 Mississippi. Again, that was 3, we're gonna do 10. 1 Mississippi, 2 Mississippi. Again, 4. 1 Mississippi, 2 Mississippi. 5, again. 1 Mississippi, 2 Mississippi. Again. 1 Mississippi, 2 Mississippi. That was 7, don't raise those shoulders. 1 Mississippi, 2 Mississippi. That was 8. 1 Mississippi, 2 Mississippi. Good. 9. 1 Mississippi, 2 Mississippi. Do one more. I think I've lost count. 1 Mississippi, 2 Mississippi. That's good. Perfect. All right. So what that exercise does, it will increase your posture. It will encourage not only the pectorals to stretch, but it will encourage the rhomboids and middle traps to strengthen, and that will help improve our posture and put less pressure on that area. So those are all the exercises we've done in therapy. What we want to do is do some patient education. So if you can go ahead and take a seat. Right there, fine. So as I understand it, a lot of what you do on a daily basis has been contributing to the TOS. And good news and bad news. Bad news is you kind of gave it to yourself. The good news is it's completely fixable with just fixing those bad habits and with physical therapy. So what I've taken the liberty of doing is with patient education. Now, as a telemarketer, I understand that you hold the phone kind of like this, and that's only exacerbating the problem. That's why that your left shoulder has such a much higher tone, and why and that extra muscle is like compressing those nerves and blood vessels, and it's just making it painful. So what I want you to do, I took the liberty to make this up for you, to get a headset, just $20 on Amazon. That'll help you out with that. Also, I understand that you're a new mother with a year-old son, and you're holding it in one arm, and that's only increasing the paresthesia or the numbness and your pain that you feel. So what you can do, again, Amazon is great. You can get a baby strap, and that will help. That you can put everywhere. It'll help evenly distribute the weight of the baby, and that will really help that compression, because you're not comprising on one side. Also, I understand you walk to work and you use a briefcase and you're holding it in that one arm all day. And again, all these habits are just making the problem worse. So what I want you to do, again, Amazon, $20. I want you to get a rolling briefcase. You see them all over the place, and it's just like you're going to the airport, but instead of just putting that pressure on one arm, you're just walking to work, just like that. And the last thing, as you mentioned, that sleeping on one side, like when you wake up, it hurts a lot more, because I think that you're sleeping on one side, on the left side more, and that's just putting more pressure on it. So I want you to practice putting a pillow on yourself, sleeping on your right side. Put a pillow behind your back, or a pool noodle that's like $2 on Amazon, and that will stop you from moving on that one side, and it won't be as painful. And hopefully, while we're doing these exercises for the next couple weeks, it'll help you, and we can improve those exercises. Now, therapy here is only one half of it. It's up to you to improve, to do exercise by yourself and help those habits. So I've created a home exercise program for you. So, and we're gonna do it first to make sure that you know how to do it correctly. So the first is called the shoulder blade squeeze, and it's just like we just did with that TheraBand, but instead you're gonna be doing this 8 times a day, but it's only gonna be one set. So you're gonna stand up straight. And again, you're going to pretend that there's a tennis ball right here, and you're just going to squeeze, hold for 3 seconds, stop, and relax. And again, hold for 3 seconds, and stop. Again, hold for 3 seconds, and stop. That's 3. Hold, do it again, hold for 3 seconds, and stop. Hold, do it again, and stop. Do that 5 times. Hold for a few seconds. Okay, good. That was 6. Do 4 more times. 3 seconds. And stop. 7. Hold for a few seconds. And stop. You're raising up your shoulders. Just right here. Just concentrate on that, okay? Do it again. And stop. It's 8. Do it again. 3 seconds. Stop. 1 more time. Good. And when you're at work or you're watching TV, you can just concentrate on doing that, because you only do that once an hour, so just 8 times a day. It will really improve your posture and relieve that pressure. So the next exercise, as you can see, is something called the dynamic anterior pathway stretch. And so if we're going to eat a wall, what I want you to do is I want you to stand about 2 feet from the door. Go on your left side. That's the one that's bothering you. You're going to do this on both sides, but I want you to place your hand on it, keep your fingers backwards, and I want you to just watch me do it, and rotate in, rotate out, okay? Keep your elbow straight when you do it. Keep your palm on the floor, just like that, perfect. Now go ahead and do 5, 2, 3, good. 4, 5. That's good. And that's good. You're going to do that on the other side, and 1 on each side. That's going to be 1 set. You're going to do three sets of that, and you're going to do that 3 times a day. Okay. And the other home exercise that I have planned for you is called again that pectoral doorway stretch. So you can go ahead and demonstrate for that. Perfect. Okay, good. Feel that stretch? And with any stretch, I don't want you to go until you feel pain, just until you feel a stretch, okay? And if you want to increase it, you can always move your hands up like that and hold for 30 seconds. Nope, that wasn't 30 seconds. Okay, good. And again, you're going to be doing that 3 times a day. 3 times a day, 3 sets. Just hold for 30 seconds. So it's just a minute and a half. So none of these exercises are going to be really time-consuming for you. Again, I made this for you, and I will see you on our next session. Like and subscribe.